member Faculty of Radiological Sciences and Medical Imaging at Al-Zaim Al-Azhari University, Khartoum, Sudan. He is Dean of Faculty of Graduate Studies and also working as external examiner with many universities like Johannesburg, University of Durban. So, Professor Dr. Ahmed Abdul Rahim, the mic is with you. Kindly start.
Thank you very much, Professor Jailani. Bismillah, alhamdulillah, salatu wassalam ala rasulillah. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Today topic is first trimester ultrasound of normal pregnancy. The mean duration of their pregnancy is 40 weeks based on ministerial dating, with the first day, the last ministerial period, LMB, presenting the clinical reference point. Each trimester of pregnancy is technically 13.3 weeks or 13 weeks. They rounded off of tens about, and many authors refer the first trimester as 12 weeks or 14 weeks. First technique, usually we use TVS and transabdominal ultrasound. Transabdominal ultrasound, we use it in second and third trimester, and we use transvaginal ultrasound effectively in this first trimester of pregnancy. So first trimester ultrasound indication, the most common indication are vaginal bleeding, maybe threatened abortion, suspected ectopic pregnancy, lower abdominal pelvic pain, palpable pelvic mass, uterine size, dates, discrepancy. An ultrasound has the following emergency clinical question to answer. We should answer where is the pregnancy localized. Is it intrauterine or ectopic pregnancy? Wherever the ectopic pregnancy is. Is the embryo or fetus alive? We should answer this question also. What is the probability of consequent demise of living embryo or fetus? And the other goal of first trimester sonography are estimation of gestational age by taking different measurements. So assessment of multiple pregnancy, evaluation of nuchal thickening, nuchal translucency, nasal bone, and also screening at 14 weeks for congenital abnormalities. Let us to start early, from weeks 1 and 2. We start with first phase of the cycle, week 1. The length of the average menstrual cycle is 28 days, as you know. And the first menstrual day is designated as day 1 of the cycle. So the menses usually last about 4 to 5 days. And after menstruation, the eroded endometrium is seen. So it is less than 4 mm in width. So this is the menstrual phase. Endometrium is very thin. So echogenic line is the center of the uterus. Here is the fundus of the uterus, body, cervix, and here is endometrium. This is just after menstruation. Endometrium is very thin. Then after that, the proliferative phase, and this phase lasts about 9 days. It starts from the last day of the bleeding. So during these 9 days, means from day 5 to day 14, FSH acts on the primary follicle until it becomes mature ovarian follicle or Graafian follicle. Here is so early in the cycle phase, we have small immature follicles. Then when follicle grows and becomes dominant follicle due to effect of FSH on the ovary, and on ultrasound it looks like this. So thin smooth wall, echo-free, rounded shape follicle on the periphery of the ovary, reaching about 2.5 centimeter in diameter, which is Graafian follicle. This follicle is ready for ovulation by ultrasound. This is TVS image. so representing Graafian follicle or dominant follicle.